I am Dr. Clifford Kamara from Sierra Leone. I'm now a consultant, but I was Director of Planning and Information in the Ministry of Health. As far as health systems strengthening is concerned, what can countries learn from each other? There are so many aspects of health system strengthening that cut across countries as far as challenges and problems are concerned. A few come to mind like human resources for health, the drug supply, the health management information system. So in country, there are a lot of innovative approaches that are being introduced to address these challenges, and countries can definitely learn from each other, their individual experiences, because especially between lower and middle income countries, the socio-economic and cultural situation is very similar, so it's easier to learn from similar countries. Many ways come to mind as to how countries can improve learning between themselves. Some of them are being done now, but they need to be improved. Things like study tours, exchange visits. They are not always, as well organized as they should be. And the follow-up after the visits is not always as good as it can be. But as I mentioned, there's a lot happening in countries that's not documented. If we can find a way of documenting the various experiences in the countries, either as case studies or as publications, or simply as white papers or black papers or whatever you want to call them, then just sharing this information between countries will be useful. It's important maybe to mention that the existing regional health institutions, and I don't mean the WHOs and the UNICEF, like in West Africa, we have the West African Health Organization. This could be a good platform for sharing this kind of in-country experiences between countries in West Africa. The decision to want to learn or not want to learn can be sometimes very complex. Do I like my neighboring country? Do we have problems with them? Are we politically on the same plane? And so on. But basically, when we're talking technically here, many of the key decision makers are not well informed. They are not well informed, and they often think, we know the problems, just give me the money, we'll solve them. They don't see the justification, the cost effectiveness of taking that important step of learning from the experience of a neighboring country. And this is something that we have to try to address to the best of our ability, because this is one of the main challenges and stumbling blocks that is preventing the creation of demand for the studies and services that we are proposing.